To know the history, it's very important how the PTSD developed this as a diagnosis. It used to be called, because originally it was thought to be the combat issue. So it was called combat neurosis. And then as it go along, then they called different names like shell shock and stuff like that, because we were trying to understand. And now it's kind of diversified into different things. There are three main groups that we focus on. One is people who are civilians in a battlefield. That's one concern. The other is the people who are actively fighting, the soldiers on both sides. What are their statistics? And the third one is us watching from a distance, and we cannot do anything but to make dua and do the boycott, as Mufti Saab said. So this is this important. Statistically, very interesting. The range in the studies is from 8% to 4% to 86%. These are the study ranges. What is the common, prevalence of these disorders? WHO has come up with a better statistics, which is like if you're a part of that trauma directly or it affects you, 10% people usually develop psychological conditions, and another 10% on top of that develop some kind of a dysfunction at their work or job or education or school.
So you mind those daily activities?
Activities of daily living, yes. So those are the common statistics that come out. So it's very difficult to find out. As we get to understand this, that this is not only the phenomena in the active army personnel, we ended up classifying in psychiatry under DSM, which is the Diagnostic and Statistical Manual, kind of like a Bible for the psychiatrists. We classified it under anxiety disorders. When I was in training, it was considered an anxiety disorders. And then they said, no, it doesn't make any sense because there's a lot of differences in this and that. Now it has its own category, the disorders of trauma and its related disorders in DSM-5, which is the latest version that came out. So this is listed under as a separate problem, and what are the different types of it. So one is, let's say, so statistically, 90% of people, any trauma, they should resolve within a year. If not, then 1 to 8% people, it becomes a chronic post-traumatic stress disorder. If you have symptoms that last from day number 3, I mean, I don't know how they came up with this, but up to 3 days, if you have symptoms, that's considered normal. After 3 to 1 month is considered acute stress disorder. From 1 month to 6 months, it's considered post-traumatic stress disorder. After 6 months, it becomes chronic post-traumatic stress disorder. And the treatment varies in between. The chronic PTSD statistics are, again, a huge range, 1% to 8%.